My name is Keith Moen, and I'm the Executive Director of the NSBA. And it's my privilege and honor to be joined today by Ray Anthony. Ray is the, oh, darn it, I moved my paper. Executive Director, my apologies, Ray, of Occupational Health and Safety within the province of Saskatchewan. So he's our top go-to there in terms of OH&S. And of course, we have, as you can see on the line, Phil Germain. And Phil is, I'll still call you a relatively new CEO of Workers' Compensation Board of Saskatchewan, and much familiar face to those in the business side of things, because he's been, prior to that, was a long-standing employers representative for WCB Saskatchewan, and very much a good fit for the new opportunity. Relatively new, but although he's been in there over a year now, I believe. Hey, Phil?
About a year, yeah, thanks.
Yeah, about a year. Okay, so so just obviously we're all dealing with the new environment of you know, working safely in a COVID-19 world. And so Ray, I'll maybe start with you. If you can provide some opening comments with regards to, you know, what OH&S is doing or has been doing, or what you're seeing in the workforce, and what the contemporary rules are and how they've changed.
Okay, well, thank you, Keith. I'll begin by saying hi to everybody, and thanks for the opportunity to speak here. Right now, primarily there are 4 industries really operating. They are mining, oil and gas exploration, construction, and to a degree, essential retail. Those would be industries that support mining, construction, oil and gas exploration, and of course, just the retail part of supplying food and necessities for life, those sorts of things. As you know, the government has a plan to reopen the province, and we're currently in phase 1. And phase 1 right now is just restricted medical services, golf courses, parks, campgrounds, those sorts of things. I think you'll notice here that what they're doing, like dentists, golf courses, parks, that sort of thing, they track people that come in and go out. And this is, I think, the intention of the Chief Medical Officer of Public Health is to keep track. If an outbreak does occur, it's easily traceable to those parties that are affected and who they may infect, so that they can get the jump on trying to slow it down or eliminate it. This will go on until phase 2 begins, which is the reopening of retail and select personal services on the 19th. And I think that's the beginning of our return to work. Phase 3, which is the reopening of restaurants in a limited fashion, food services, gyms, fitness centers, licensed establishments, childcare, and the number of people that are eligible to be in one location for a meeting is 15 people at that point. Again, it's a limited opening, and it's all predicated by the Chief Medical Officer on the spread ratio of being less than 1. Prior to last week, the outbreak up in La Loche and North Battleford and that, it was down around 0.7, which means that the transmission of the disease was reducing. Now it's up to 0.95 today because of that outbreak in La Loche and North Battleford. As long as it's under 1, they will continue with the plan. If it goes over 1, they will modify the plan as needed. So anyway, then we move on to phase 4, and again, these aren't identified as to time in the plan as yet, but a reasonable guess would be phase 3, the reopening of restaurants, food services, would probably be early June, and phase 4, the reopening of indoor-outdoor recreation, increasing the size of public gatherings to 30, etc., would likely occur near the end of July. And then phase 5 would be the lifting of all long-term considerations. I'm thinking that will likely be before school starts in August. That's just my guess based on the way the thing has been. But again, it's being closely monitored. As long as they seem to have control of the disease, that's the way they'll continue to operate. So I'll just leave it there with you, Keith.
Okay, thanks, Ray. I see we have a question arise already, but before we jump to that, I will maybe turn it over to Phil. And Phil, if you have any opening comments that you'd like to provide us with, please do. Oh, sorry, Phil. Looks like you're on mute. We have to get you to unmute. There we go.
I do that lots. Thanks, Keith, and good morning, everyone. Appreciate the opportunity to participate with you guys, with everyone. From a WCB perspective, we've been adjusting, obviously, to this whole situation. First, getting 500 staff out of the building and working, which they are, and they're working quite efficiently and effectively remotely. So that's been a new and a pleasant surprise for us. But when it comes to COVID, we've taken a number of measures from a business perspective to try and support industry. In particular, we have deferred any payments for premiums, and when we say deferred, meaning employers aren't required to pay premiums, and if they don't because of the situation, then we aren't charging penalties or interest like we normally would. That has been extended to the end of June, and we're revisiting that right now just based on some other information we have and considering extending it beyond to the end of June. Information that we have suggests we won't really know the impact of this until probably July, maybe not even into August, but should be able to have a good handle on it by then. The other interesting thing from a premium perspective is despite the opportunity for employers to delay premium payment, typically they're not. We've had as much premiums come in this year as we did in 2019 to this date. It's almost identical, which is quite surprising to us. When it comes to dealing with claims in particular, we've made a couple of different decisions. One, we know because some industries were shut down due to the state of an emergency, as well, which included supports like physio, medical, chiro, those types of things. We knew employers were going to have a hard time rehabilitating and returning injured workers to work. And in some cases, when there was a return to work, that individual is no longer working because the business had to shut down. So all those costs from the date the state of emergency was instituted, any costs associated with the state of an emergency, those costs will actually be applied to the system as a whole. They're not going to end up on, we're going to be providing employers cost relief related to those situations. The other thing that we've done, because of this is such a challenging situation to manage, in a sense that some people who have COVID don't even know they have COVID. So you're passing it on. We've seen that in a number of different workplaces, in particular outside of Saskatchewan, but even within Saskatchewan. And in those situations, any worker who contracts COVID, we're actually going to remove those claims from an employer's experience, partly because there's no vaccine. And in many cases, despite best efforts, workers and employers sometimes don't know that the disease is being spread. So, it's not like, well, I know I've got the common flu. There are people who have COVID and don't know it. They're not showing symptoms. So we've got the board, we've worked with the board to put in temporary measures to create those three relief situations. One, deferring payments. Two, to make sure anybody with an existing claim prior to the state of emergency, that if the length of the claim extends because there's no medical, no return to work options, those costs will be provided cost relief. And then the third, any actual COVID claims will be pulled from an employer's profile, certainly during the state of emergency. And we're looking at that because we don't know if that needs to extend out until there's an actual vaccine. And at that point, it might actually be treated like every other common flu if the quote unquote pandemic is over.
Well, that's encouraging to hear, Phil. I was had a few questions prepared, and you've answered several of them just from that basis. So let me just maybe go back to you based on your most recent comments. Then, what in terms of contact tracing and so on, if it's actually seen as being traced back to the place of employment, does that then would that change anything, or you'd still follow through with the processes what you've just described?
Still follow through with the processes. The caveat that we're looking at is if an employer is charged with violating the Public Health Act, so they're kind of knowingly not following any practices,
right,
we might reverse that decision. But realistically, our intent is to remove them regardless of circumstance, because the story I've been telling, and it's a made up story, but the story I'm telling is you could have a construction project going on in Stoughton, right? And the construction company has a meeting after dinner, everybody gets together, and the waitress that served them or the organization that provided the meal or delivered the meal may 5 days later be discovered that that individual was the only person in Stoughton who has had COVID, and now a bunch of your staff have COVID that were in that environment. We now see a strong correlation between a work-related activity, right? A work-related meeting, so to speak, and the contact with somebody who's known to have COVID in that work environment. Those would be considered work-related, those types of situations. But again, we won't leave that on the employer's record because it is just so hard right now to know whether or not somebody's being exposed.
Mm-hmm.
We've had a pandemic policy now through SARS and H1N1. We're one of the few jurisdictions. So we've got a pretty good handle on how to manage and adjudicate pandemic-related claims. We do a lot of contract tracing. They're not easy to figure out if they're work-related. The last statistics that I saw on Monday we've had 70 applications, so 70 people apply for COVID-related claims. I think 5 were pending and 11 were accepted. And it takes a while to figure out all the contact tracing, like who was this individual in contact with, and where did you contact them? And if you happen to contact somebody with COVID while picking up a coffee, that's not work related. If you happen to have contacted somebody known to have COVID in that work environment while doing your work, now it's a work related claim, but won't go on the employer's account.
Right. Okay. Excellent. Okay. Ray, and first, before turning it back to you, I'll encourage all of our webinar participants to, by all means, bring your questions forward, because we have the two foremost health and safety folks within the province here at our I won't say disposal, but rather available to us, and so therefore I would encourage you to bring your questions forward, and we do have a couple. And actually, just to do so, you can do so through the Q&A or the chat portals on the bottom of your screen as you move your mouse around. So Ray, as you were giving your opening comments, we had a user come back with a comment around the hotel industry, and their concern is that that they're open, and they're also concerned and have uncertainty about what sort of protocol to follow, and the comment that's made is that this is a very important industry that seems to be forgotten. How would you, and I would have to tend to agree with that to a certain point, in that the hotel industry is perhaps, and certainly from an impact perspective, they've been impacted as much as any industry within the country, quite frankly. And so what response would you have to that particular concern in that the hotel industry itself is being challenged, and what might be done in terms of implementing safety protocols that would enable them to open in a safe environment?
Well, all I can do, you guys, is I'll read you a section that's directly from the public health order, and this has been in all of the public health orders, or the variations of it that have began since mid-March. It says, in the event that a critical public service or an allowable business service is unable to maintain 2-meter social distancing, other measures such as self-monitoring of personal health or supervision by infection prevention and control officers or occupational health and safety in that workplace shall be applied. So that said, you guys, what they're talking about is you need to use a self-assessment tool on your employees. Essentially, if they show up with a fever, cough, headache, aches and pains, sore throat, chills, runny nose, any of that, they need to go use the tool that's available online through the government website, or contact 811 and be tested. That's the most important thing. In the meantime, again, the spread of the disease seems to be primarily through touch. So, I mean, in a facility such as a hotel or whatever, things have to be cleaned far more frequently than they would normally be. That, you know, everything from public washrooms, elevator buttons, door handles, you name it. I can't say much more than that. You know, I mean, really, there is no magic about this. It is a public health crisis, and if you're going to be open for business during it, the same conditions would apply almost regardless of whatever industry you're in.
Right.
Yeah.
Okay. Yeah. Sorry. Go ahead, Ray.
No, not done.
That was it? Okay. Well, we have a few more questions that have arisen, so I'm going to just ask them outright. So when, and I think this was when you were commenting as well, Ray, but I'm not entirely sure. So either of you, I'll pose it to whomever would like to answer, because really it's looking at a forward-looking process. And so it says, when you say that your current, when you say your current guess is for phase 5 to be implemented prior to schools opening in late August, do you know what the maximum capacity will be for mass gatherings at that time?
No, again, that'll be up to the public chief medical officer. I mean, all of these orders are his, and they apply to everyone in the province, not just those at work.
Okay. All right. Any comments from you, Phil, in that regard?
I don't, if you don't mind, I wouldn't, just to add to Ray's the previous question.
Sure.
For employers that are looking for some guidance specific to their industry, I would recommend going to the WorkSafe website or the Canadian Centre for Occupational Health and Safety website. WorkSafe BC's got some pretty good resources too that are industry specific. So they've taken certain industries, and they've tried to provide industry specific guidance about how to deal with COVID.
Yep.
So just some food for thought there. Okay.
All right. Thank you. And the other thing too is when you talked about you know, the return to work and Phil, the scenarios that you were providing with respect to you know, presumed COVID or what have you. What have your two organizations, and I'll pose it to you first, Phil. What have you been doing with respect to the Ministry of Health, the Health Authority, Chief Medical Health Officer, et cetera, with respect to encouraging the testing processes? Are you involved with that in terms of some of the advocacy or lobbying that you may be wanting to see at you know, certain job sites or you know, as people travel to camp jobs at airports and so on? What sort of activities have you been involved with in terms of promoting the higher degree of testing at this time?
Yeah, it's a good question, Keith. We haven't been, well, we're part of the provincial emergency response team. We haven't been specifically weighing in on the public health. Obviously for us, you know, that it's one of the reasons why we partnered with the Canadian Centre for Occupational Health and Safety to see specifically what specific industries could or should do to mitigate the contact and spread of COVID. As it relates to testing, I mean, I think there's a general theme out there that more testing is better, for sure, regardless of the circumstance, because then you can trace and quickly contain the issue. I think that's going to be a critical component to opening up the economy. Is if there is an incident, you need to be able to quickly figure out who's been in contact and when, and testing and knowing who has it and where they are and where they've traveled is critically important. But we haven't really been lobbying, other than obviously as it relates to claims. We want as many people tested and verified. Like a lot of the applications for our claims, people don't have COVID. They may have symptoms, but they don't actually have COVID. So testing is critical for verifying, some kind of work connection to any of these issues.
Okay, thank you. Ray, anything to add from your standpoint in terms of OH&S?
I sort of echo Phil's comments. Certainly, we advocate for more testing. It is important, both to discover the path of the disease and try and get ahead of it and isolate, but also if someone has tested positive and is going to return, we certainly don't want them returning to work or going out in public until they've tested clean that they're no longer infectious, right? That said, as far as the ministry goes, we do continue to do inspections. We have a number of joint inspections with public health going on right now throughout the province. We also have a number of staff that have been seconded to other government ministries up north doing things like the social services or assisting with traffic control with highways and those sorts of things. So it's a very busy time for the ministry.
Without question, for sure. Just looking to our chat area here, I see another question. I should have prefaced my comments by saying that my background is not in either of the HR or safety fields, and so when it comes to some of the acronyms and so on, I might be unfamiliar. So I'm just going to repeat this question as it's phrased, and hopefully you know what they're talking about, because and I assume you do, but I do not. So it says, how is COVID affecting A&D testing? And is work, so I'm assuming absentee and but anyway, I'll leave it to you guys. Is workplace safety being compromised? Who'd like that one first? And actually, who can identify what A&D is for folks like myself who are not familiar with that particular?
I'm actually interested. Ask them to clarify that a little bit. Okay.
I think we just have. So if that particular panelist would like to clarify what A&D testing is, that would be much appreciated. Oh, there you go, alcohol and drugs. Thank you. I put you on the wrong path with my absenteeism comment. So how is COVID affecting alcohol and drug testing? Is workplace safety being compromised? So yeah, very valid question to what was previously a very and still is a strong area of health and safety concern. Is that because of the new emphasis and focus being put on COVID-19, is that particular area being compromised as a result of this?
That's a good question.
I haven't had any complaints with regard to that so far that I know of. So I would say it isn't.
Okay. Phil, anything to add there?
Yeah, I'm trying to understand, trying to think of how COVID might impact that. I mean, the big challenge, I think, for isolation is a challenge. I think that it's more of a public health issue right now. I mean, not to make light of it, but certainly I was in a meeting with a bunch of CEOs from across Saskatchewan a few days ago, and there was a statistic that the average person working from home is having 2 drinks a day now. And I think that's a North American statistic. Retail sales of alcohol are up, from my understanding, about 15 to 18%, while obviously commercial sales are down. So it's a good question. Are people drinking more because of this situation? And then the secondary question onto that, does that impact their work, their ability to work? And does it change an employer's ability to do what they were doing before in terms of monitoring and managing, all types of situations, fatigue, drug, alcohol, that impairs somebody's ability to work safely? It's a good question, and I honestly don't know whether or not that, other than the fact the statistics suggest people may be drinking a bit more, I'm not sure that it negatively affects people's ability to fulfill whatever programs they already had in place to deal with situations where people aren't fully safe to work. So.
Okay, all right. Thanks, gentlemen, for those thoughtful answers. I'm going to come to one of our participants, Pam Gaunt, who has asked to ask a question. So I'm going to allow her to speak, and hopefully I don't screw this up too badly. And Pam, hopefully you're still there and able to ask the question verbally. So please go ahead, Pam. I've unmuted your mic. It looks like you have to unmute it as well. There we go.
And you know what? I pushed that by mistake. I apologize for that. I wiped my phone down and I hit that raise hand button. So I apologize.
That's okay. But while we have you on the line, do you have any questions for either Phil or Ray? Or
you know, I don't really. I guess at the end of the day, you know, everyone's curious as to what the going forward plan is when they start opening up in these phases. And I'm assuming they're going to have specific things that we have to do as clients going into these places, whether we have to take masks or all of those things as they roll out. It just seems like, oh my God, you know, how do we make this happen?
Yep. Yep.
That's all I've got.
Okay, no, that's all good. Thank you, Pam. We have had another one come up through our chat area here, and again, it's a very valid question. What if an employee refuses to work because of the virus? What does an employer do in that situation?
Can they be clarified? Can you clarify a little, like because they've got it, or?
Well, no, I think, and again, I'm speculating because I've virtually read it as is, but I would assume that means if they are fearful of getting the virus from, you know, contact with the public or other employees, you know, being reinserted back into the workforce, what if they just exercise a right of refusing to work? Does the employer have any recourse? Oh yeah, it says just a general fear, and this is in the hotel industry again. So what if you know, someone from the restaurant or housekeeping, etc., chooses not to work? What options does an employer have at that point? Maybe I'll turn to you first, Ray.
Well, I can only go tell you what OHS would do if it came in as a formal work refusal. Like the hotel itself is got to have an occupational health committee. And so the first step is to have the committee review the complaint and then rule on it. If they rule in a majority against the worker, then the worker needs to return. If they don't, if they have a split decision, or if the worker is aggrieved, he can refer it to the division and we'll look into it. Generally speaking, work refusals, a worker can refuse to do anything that's unusually dangerous. That means that they're not trained or equipped to handle it. I got to say, if the chief medical officer is allowing that as a critical industry to continue, if the employer is taking steps as far as the sanitary conditions, hand washing, if they're addressing those hazards as they should, I would probably say that we would rule against the work refusal. But generally speaking, you refuse to perform a specific task, like something that would require you to maybe get within 2 meters of somebody else or something like that. You don't refuse to just show up at work. Now, as far as that goes, I mean, I would suggest everybody talk to their HR department or to their attorney. But, you know, I mean, it could be, if they're just flat out refusing to come to work, I'm pretty sure it could be considered an abandonment of the position.
Okay. All right. Bill, any thoughts to add there?
Yeah, I was going to echo what Ray had said, not being a lawyer, but having actually sat in a webinar on this topic recently. You know, the two labor lawyers that were speaking pretty much said what Ray said. You know, if somebody doesn't show up to work, it's abandonment. The worker's really only recourse is to show that there's a legitimate work accommodation or a real health and safety risk. Barring those two issues, then it would probably be considered work abandonment. Yeah.
Okay. All right.
Yeah, I think it's.
Sorry, go
I
ahead,
think it's
Ray.
important to keep in mind, we have sort of two things here, right? Like one of them is right now COVID-19 is out in the world, and there's a risk. But whether that rises to the level of a danger depends on, like, I mean, right now I don't think we've had a tested case show up in Regina in, I don't know, probably five to 7 days. And so, you know, I mean, again, that means the risk here is very, very low. You know, now if you were to go into La Loche, sorry, that's a different story entirely. So again, it is really now almost location-based and risk-based.
Yeah, great points, Ray. Thank you for sharing that. So I'll just turn to some of these questions that I have that were submitted prior to our webinar here today. And what I would like to know is, and I think probably to you, Ray, that this question should be directed. It says, what minimal PPE should be provided by employers to employees when they are required to complete a task within 2 meters of each other because it can't safely be done on their own? And there I would, you know, point to perhaps a scenario where there's a heavy piece of equipment or something like that that would require, you know, that would be dense and heavy, that would require folks to be, you know, 2 of them lifting it rather than one person, you know, putting their back out per se, than trying to lift a heavy object on their own. They require assistance and therefore are within the 2 meter guideline or regulation. What PPE or what preventions can be taken to accommodate this type of work safely?
Okay, again, I'm going to be a little bit long-winded here, but I'll repeat sort of what the chief medical officer had said, that if it is not possible to maintain the 2 meter distancing, you need to self-monitor. And like, I mean, when you think of it, you'll see some employers are actually taking their employees' temperatures when they come to work. You know, they're asking the questions, you know, do you have a cough, fever? Are you staying with anyone who has a cough, fever? Did you, like, have you in the last, you might ask the question, have you in the last 14 days been in La Loche? Those sorts of questions you ask, you know, in the self-monitoring vein. And if they are, you know, I mean, they should either self-isolate or whatever, remove themselves from the workplace. Again, I mean, there's really no magic to this, you guys, and it's been around before. If you look at the regulations that we have under health and safety, they follow a path. Like the first part of the path is you have to provide washrooms for your people. And okay, that sounds simple enough, but then you have to provide a means of hand washing. And there's a reason for that. Hepatitis, all those sorts of things follow along with fecal matter. And there's a reason why we have hand sanitizing stations, those sorts of things, to prevent the spread of those diseases. And then finally, normally a worker at some point is going to go eat lunch. And if you don't have a clean place for them to eat lunch, a means of them to clean their hands, you will have influenza spread. You will have a good chance of spreading hepatitis and those sorts of things. And I know for those people that might be in construction or management, you know, it sounds kind of trivial, but it really isn't. You'll substantially improve your sick leave figures, and that if you encourage and provide for adequate hand washing and washroom facilities. And so I'll just leave it sort of at that. Right now, there is no order that requires that a respirator be worn, unless you're actually dealing with someone with the disease and doing an aerosol generating procedure, which would require at minimum an N95 mask. Mm-hmm. But of course, a lot more than that, they would have to wear smocks, head, foot covers, all the whole nine yards. In this case, there's simply a risk that you may be in close proximity to someone that may or may not be infected, and you have to take reasonable precautions. Fair enough?
Yep, absolutely, for sure. Phil, I'll turn to you just to see if you have anything to add. I'm sure that the Ray's covered most of it, but anything from a WCB perspective in this area, if there would be a claim forthcoming from someone perhaps not looking to a colleague to get them to help because of that fear factor with respect to potential contraction of COVID. How would WCB look at a claim that may come as a result of someone perhaps acting improperly because of COVID fears? Oh, you're on mute again, I think, Phil.
So if somebody, we've had several requests where people have submitted claims because they're fearful they're going to contract COVID within the work environment. We've not accepted any of those types of applications for claim. Most of it is what Ray has said, but from a WCB perspective, we don't consider it an actual work-related claim unless there's injury or harm, which means you've contracted the virus. So, and then from there, we need to figure out the work-relatedness of how you contracted that. Was it work-related or not work-related, which is the contact tracing that we try and do as best we can to try and figure out where that source came from.
Mm-hmm. So just on that vein then, Phil, with respect to your opening comments around COVID and how it impacts WCB, in terms of claims and so on. So if there were ever to be a time when it did actually start to become a WCB claimable absence, would that have a different sort of effect on an experience rating than what a typical absence or work-related injury may cause? Like, would it be looked at differently, I guess is what I'm trying to ask? Or would it just fall under the same umbrella and experience rating is X or Y because of the result of the claim?
Yeah.
Of course, so there's speculative, right? So, but
yeah, no. There's two aspects of that. So one, if it's in a COVID claim, those claims are going to be removed from an employer's experience. So from that perspective, it will have no impact on their experience rating. In particular, if you think about industries that bid work, where claims being on your file could impact your ability to bid on work. Again, those won't be on your experience. If they are, they're only there temporarily, and we'll have to figure out how to move them and where to place them within the system so we continue to still monitor them and have them connected to that employer. But the employer really won't see it on their file, and neither would any bidding organization, for example. When it comes to an existing claim, like I said, that's not COVID related, but it was a pre-existing, somebody hurt their shoulder, was going through rehab, maybe on a return to work, temporary full return to work, and now the emergency situation has caused that employer to shut down, or the worker can't access medical in order to make sure it's safe for that return to work. Those costs will apply cost relief to those costs. So again, that they don't overly impact any particular employer or industry. And part of the reason for that is because, like I said, in a lot of cases, people who are spreading the disease don't know they are. So it's not like, even if you test somebody today, doesn't necessarily mean they don't have COVID. Meaning, if you do a temperature test or you talk to somebody showing any flu-like symptoms, right? The employer, as Ray has said, those are questions and things that you probably should be doing, but it doesn't mean the person doesn't have it, and doesn't mean the person isn't spreading it. It's unknowingly. There are situations, luckily, I'm not aware of any necessarily in Saskatchewan at this point, but there are many in North America where this has happened. Individuals have shown no symptoms, but yet have the virus and have spread the virus.
Oh, sorry, it took a second to get unmuted there for myself. So thanks, Ray. Thanks, Phil. Appreciate that commentary for sure. We have a question that's arisen out of the Q&A chat, and it's again speculative, but it says, and I'll just read it verbatim. I don't know if you can answer this sort of question, but are you allowed to deny someone into a business that's coming from a highly affected area? So back to your scenario, Ray, of having someone coming from, say, La Loche, as an essential worker, and then they want to go and, to retail operation or get their back, in alignment at a chiropractor, does that particular business or employer have any rights of in terms of denying service to someone who has been exposed to a highly affected area?
Is our act and regulations only apply to workers? I can't really answer that for you. I mean, certainly if a worker has come back from someplace like Laloche, yeah, you could order them to go into self-isolation for 14 days. But I can't speak to the public accessing the business.
Okay, all right. And maybe I misinterpreted that question a little bit differently than what it was intended. So if that particular person who posed the question wants to rephrase it in a way that might be more along the lines of what your intentions were, please do so. But Phil, I'll turn it back to you. So same scenario. Does a business have a right or an ability to deny someone into their business if they're coming from a highly infected area, or affected area, I should say?
That's a really good question. One that I don't know. I mean, I know lots of businesses have shut down. They're limiting, and even if they're opening, they're limiting access in terms of the number of customers that are coming in. I mean, if it's obvious that there is an issue, somebody's showing symptoms, I would argue that's no different than somebody maybe showing up to your business with a knife in the hand, where it's like there's a legitimate concern that you may have, right? But whether or not there's legal issues around denying somebody because they were up in Laloche and they're not showing symptoms, yeah, I have no clue how the courts would interpret something like that.
Okay, great. Well, thanks again, Phil. Another question that's come up through the Q&A portal is dental hygienists were flagged as an occupation most at risk of contracting COVID from an infected patient, yet they have been allowed to go back to work in the first phase with no change required to the PPE they presently wear. What are your thoughts about this? So should, I guess,
I don't believe I don't believe that's true. Like they'll be wearing actual respirators. They'll be wearing N95s, and they'll be. I believe the dentists are restricted on conducting aerosol generating procedures, which means they'll be allowed to use suction but not blow air or water. There have been things taken, but again. The nature of that type of work is one that spreads disease, because you're working in someone's mouth. So if they have something, then there's a chance that you may catch it, and it has always been that way. It's just now that there's the risk of COVID-19 out there. They were taking really good precautions prior to this, I mean, this would be just an extension of it.
Yeah, very good points, Ray. Thank you, Phil. Anything to add there?
No, but we have talked about that, certain occupations that as we open up into phase one, working again with organizations like CCOH&S to see if there are any additional industry specific brochures or information documents that we should be developing and publishing, because there's uniqueness, right? As Ray has pointed out, that industry is typically quite good, but are there some additional steps that maybe should be taken that aren't really obvious that might just help everybody elevate the level of safety for everyone involved? I don't know that right now, but we are talking about whether or not that's the case as we move into phase one here.
Mm-hmm. Okay. Well, just on that, Ray, I'll come to you in terms of, obviously we're now just in the early stages of phase one. And one of the questions that was posed to me from beforehand, which I've want to put forward to you is just plain and simple: how active should occupational health and safety be during the crisis? So, should OH&S have an active role in ensuring compliance of staff and visitors, and if so, what would that look like?
Well, if you look at the legislation, it basically says that the duties of the Occupational Health Committee are to participate in the identification and control of health and safety hazards, and basically to cooperate with any service, that would be internal or external, if you have a safety professional or you contract such, to work with them, and to promote and recommend the means of delivery of programs and education. So I mean, there is a role there for them. And the role is to participate and make recommendations. But at the end of the day, the role of consulting in that, you know, I mean, the employer at the end of the day has to decide how they're going to run their business or operate the business in light of the orders of the chief medical officer and in light of what they're actually doing. You know, the type of work that they're engaged in, and take reasonable precautions. Quite often what we're seeing now, like the issue of taking everybody's temperature before they come into the workplace, the issue of perhaps allowing people to wear masks and that sort of thing to work, you know, I mean, they're sort of being handled on an employer basis, like depending on the type of work they do and depending on what they are. But they're not things that the chief medical officer has called for as of yet, except in specific industries. And like, I think right now for people that work in health and senior care, healthcare, they're the only industries where it's been mandated that temperatures be taken and that sort of thing. Okay. So the answer in short is yes, there is a role for them.
Yeah. Yeah. Okay, great. Thanks, Ray. And Phil, I know that you've answered some of this, if not all of it already in terms of your comments, but I'll ask a specific question to see if anything else comes to mind. And what that is what due diligence does an employer need to do to prevent a COVID-19 case from becoming a WCB claim? So for instance, daily self-declarations that they are symptom-free, anything along those lines that from a due diligence perspective that an employer should be following so that they don't fall within or outside the regulations or requirements of WCB, so it doesn't become a claim, I guess.
Yeah, it is a good question, and I think one that lots of employers are, well, almost all employers are thinking about. So there's two aspects to that question. One is WCB is no fault. So even if the employer is doing everything they can, this is a very unique circumstance, again, where even the worker could be coming in showing no symptoms, but have the virus. So it is one of those situations where, you know, I think lots of public officials have said this, opening up the economy, there's risks if you don't open up the economy, obviously, mental, physical risks, and obviously our economy in general. So this is weighing out all the risks that are that we're going to face. There's no perfect answer. There's no way to perfectly mitigate people from contracting the virus if they're coming back to work. But as Ray has pointed out, there's things that can be reasonably and practicably done so that from an OH&S perspective, there isn't an issue. From a WCB perspective, regardless of how it happens, if it's work-related, we'll accept it. But recognizing the challenging situation that employers are in, it's not going to end up on their account.
Okay, great. Thank you. We do have a couple more questions that have arisen, and just wanted to advise our folks online that we have about 10 minutes left. So if you have a question that is not being addressed so far, please bring it forward. We'll get to it as quickly as we can. So firstly, it's with regards to the phase 4 scenario. So it says a phase 4 question. They'd appreciate some clarification from an earlier comment that the end of July is possible as a possible reopening date based on the anticipated spread rate of less than 1. Is this baseline number for a specific community or for the province as a whole?
Yeah, that's just my educated guess based on the, like there are no dates right now attached to those. It's just that there seems to be a period of 2 to 3 weeks between each of these phases. So as long as the chief medical officer, Dr. Shahab, has said that they will continue with the plan so long as that transmission rate remains below 1. If it goes above it, they'll modify the plan. which means they'll change the dates, they'll change everything else. It is interesting. There was a comment made by, I think it was a mayor or something like that up north, that actually the isolation criteria should be almost municipal. That certain communities should be isolated off. Because that would be probably the most effective way to fight it, and it's starting to look like that might be true, but they haven't done anything like that yet. Certainly in the southern half of the province, in the Regina area, they've done very well. Saskatoon somewhat, but slightly less, because there is some filtration in from Lloydminster and from La Loche, North Battleford. Where they do have a high number of cases, and the trouble is, by the time they get it traced, track these people down, put them into isolation, they spread it to a number of other people. But generally speaking, the southern half of the province is doing much better than the northern half right now. But again, you guys, like this thing, when we first started on it, the joke was it changed day to day. It was almost changing hour to hour. As far as we were concerned, it was, we really didn't know the extent to which it had spread. And honestly, Phil's comment toward getting more testing is key to make sure that we've got the lid on this thing as we go forward into phases 3, 4, and 5.
Mm-hmm. Yeah, I couldn't agree more. Thanks, Ray. Phil, any comments that you have in terms of whether or not the community would be looked at in isolation, or if it should be province-wide in terms of the reopening future phases?
Yeah, no, it's my understanding right now it's a provincial number, but I agree with Ray. I think as more data and information come out, it's looking more and more like, there might be a move towards localizing that decision, which would make sense to me. But I have no opinion on that, really.
No, that's quite all right. Another question that's come up through the chat is we have a question that says, do you know if it's advantageous to use an electrostatic disinfectant sprayer versus regular cleaning methods? Either of you?
I do not, but if they want to call our 1-800 line and speak with a hygienist, they would likely know. Either that or call SaskHealth. Okay.
All right. Phil, anything that you have to add in that area?
Yeah, I was going to say, the phone the 1-800 line, they've got industrial hygienists, health specialists that I think can answer that question better. I haven't heard that there's a significant difference, but that doesn't mean that I haven't missed that information. So.
Okay. And you know what? I don't have that 1-800 number here handy in front of me, and sorry to put either of you on the spot, but do either of you actually know that number so that we could just advise the participants today? Is that something that either of you know off the top of your head or have access to readily?
Just a sec. I'll dig it out. Hang on.
Okay. All right. And while you're doing that, I'll just
or continue, and I'll jump back in when I find it.
Yeah, absolutely. That sounds good. Thanks, Ray. As I was going to do, just to remind our attendees that we have about 5 minutes left of availability for our two foremost, I should say, provincial experts when it comes to workplace health and safety. And so I would encourage you to bring your questions forward as sort of a last chance, a last call, if you will, around that. I guess one question that I'll pose, and again, it's going to be speculative, but with the new environment that we now have, what it's going to do is, obviously there's a lot of fear in the communities and in the province and frankly across the globe. What does that do to in terms of future claims, Phil, in your respect, around mental health, like if people are going to be worried about being exposed and where you foresee that type of thing, or vice versa, if an employer is perhaps or manager is being quite forceful in terms of their directives given to the employee, and a harassment claim maybe as a result. How do you foresee things playing out in the new environment with respect to mental health and harassment potential claims?
Yeah, I think that's a really good question, and in fact, timely. Just today, I think we're sending out email blasts to every employer where we have an actual email, and I think about 21,000 of our customers. We've partnered with one of the foremost psychological health and safety specialists in the country. She helped develop the national standard for psychological health and safety, the CSA standard. She was one of the architects of Guarding Minds, which many employers use as a framework. Her name is Dr. Jody Samra. And we're reaching out to employers right now to find out what some of the challenges are. Because it's one thing to understand a standard and read the literature, and then it's a completely other thing to implement it in your situation. Because I think, personally, I don't know this, but I think the COVID situation is going to have a profound impact on people generally, and will have a lasting impact for months, if not years, on how people think about the workplace and just going out and interacting in general, which could add stress and lead to mental health issues. So I think it's going to be important. The good thing is the province, employer associations like yourselves have been talking about this issue for a few years now. I think many employers are seriously thinking about it. They've been trying to implement and develop programs and initiatives and training. So we're working from a bit of a foundation now, which is good, but we're trying to figure out how to take this strategy and amp it up one more step and go from kind of the generic conversation to specifically how do employers start to address some of those issues. So, it would have been nice in theory if we'd have started this initiative, this phase of our provincial program 6 or 12 months ago, hindsight being 2020. But, we're getting out there right now and trying to interact with the employer community and find out, from their perspective, what is it that they think they need from us, and we'll start to develop and implement programs that help them address more specifically some of the challenges that they're having.
Mm-hmm. Yep. Thanks very much for that, Phil. Ray, I don't know if you were able to hear that question while you're trying to dig up that 1-800 number, but I'll just maybe repose it for you so you have some context. Just asking about the future scenario, and you probably gathered it from Phil's response of where the impact will be with respect to mental health and from a maybe adversarial or protagonist type of role as an employer. If an employee perceives that they're being harassed and they bring that forward, what do you see in terms of the employee representation as being where you see the new world taking place in respect to the workplace? Is that too vague?
Okay, first thing I'll do is give you the phone number. It's 1-800-567-7233 or 1-800-567-SAFE, if you want to go with that. Certainly, I think mental health is going to be somewhat negatively affected. I know personally I've been working from home in the basement here for 2 months, and it's getting a little dark down here. But so I mean, you're going to get a little of both. You'll get some people who'll be quite happy to return to work and a return to more normal times. You will get some people that are returning to work that have not had income. Those so those will be on the positive side, one would hope. But you do have and will have people that have a lot of fear. Let me point out that harassment doesn't include any reasonable action that's taken by an employer, manager, or supervisor. So, I mean, as long as the instruction is delivered with regard to the work to be done in a reasonable manner, I don't think there should be a problem. It should not be to be deemed workplace harassment. Again, if a worker is really, really frightened, they should they should, you know, I mean, if essentially they're asking for an accommodation, and if they require a medical accommodation, well, they should provide medical evidence that they need one. You know, I mean, and it should be substantive and directly related to the risk at hand, not something unrelated, as it were. By and large, harassment for us falls into two categories. One is the stuff around basic human rights, you know, race, color, creed, religion, sex, that sort of thing. The other, of course, is psychological, and that goes to repeated conduct or single conduct that negatively affects a person's health. And, you know, I mean, the negative impact here is from the fear of the disease, and there's not much an employer can do about that. They can take precautions, they can try and alleviate the employee's fears, but at the end of the day, I mean, it's up to the employee whether or not they can work. That's about it.
Yep. Great points. Thanks for raising them. Well, gentlemen, I see that we've gone into the lunch hour here by a minute or two, which is all well and good. We're not cut off from our webinar, but it is typically our closing time. And so I'm just going to put it out one last time in terms of a last call to our attendees if they want to ask a question while we have these two gentlemen available for us. That would be now would be the time. And also, I'll just bring to your attention too that I have posted the number that Ray brought to our attention on the chat area there. So if you missed it during the verbal disclosure of it, it's there for you to write down. It's 1-800-567-7233 or SAFE as indicated in the chat. And I see by my rambling, trying to buy some time, I haven't created any more interest in terms of any of the Q&A forthcoming from our panelists. So what I'll maybe do now, gentlemen, is just turn it to each of you to see if you have any closing thoughts, anything that you want to share that you think is an important area of discussion that we didn't get to today. And if not, then we can just turn it back. I'll close off after that. But to each of you, maybe Phil first. I can see your face, so I'll ask you first. Do you have any closing thoughts that you want to share with the people here today?
I would just like to thank you for inviting us and being part of this discussion. I think a lot of these topics or issues, everybody is extremely busy dealing with their reality, and though while we think we're out there communicating some of our decisions, you know, I think these are good opportunities to liaise with the business community, understand what we've been up to, and then take your feedback and see if we need to adjust our path in any way, shape, or form. And the reinforcement I would like to say is that on the mental health side, you know, if you get one of the emails from us, you know, if you can take a few minutes and respond to the question about, you know, what is it that you think we might be able to do to help, or some of the challenges that you can't seem to resolve, would be really important for us to figure out how to develop what new programs or approaches we need to develop, because in particular, I think mental health related claims or issues, whether it's work related or not work related, you know, have a profound impact on workplaces, no question. And it really is, you know, that ounce of prevention is worth a pound of cure. It's really evident on the mental health side. Once these issues get out of control, they're hard to get back control from everyone's perspective, the employer, the worker, the healthcare practitioner. They're not easy things to resolve, but we know by creating kind of those mentally healthy and safe workplaces, and there's tricks and not tricks, but there's approaches you can take to developing that environment. That does seem to go a long ways from preventing a small problem from becoming a large problem.
Mm-hmm. Well said. Yeah, absolutely. Thanks, Phil. How about you, Ray? Anything you want to add in closing?
Again, you guys, thanks for letting us have the opportunity to speak with you today. I would say that you know, I mean, there are a number of sources you can get information from. Phil alluded to a couple of them. One was the Canadian CCOHS, the Canadian Centre for Occupational Health and Safety, but we also have 7 safety associations in the province that are funded through the WCB. So if you're in those rate codes, you're de facto members. Take advantage of them. They've been working diligently on this. The Hospitality Industry Safety Association, for those that are connected with hotels, Jim Dennis and those people have done a lot of work on this. They're a resource, use them. I realize that these are quite concerning times. None of us were really ready for this. None of us really saw it coming. We just have to work diligently and make the best of it and get the province back on its feet again. So thank you very much.
Agreed. Well, thank you. And I'll just close off by thanking each of you for your time and expertise and wisdom and thoughts here today. I can't express enough how valuable and appreciative we see yourselves in terms of creating a safe and healthy workplace, certainly in the past and moving forward. So I want to thank you for you and your teams for all your hard work that you've done in this area, because we're a strong proponent. The NSBA is a strong proponent of a safe work environment, being one of the charter signatories of the Health and Safety Leadership Charter. Way back when, I can't even remember what year that was, but probably around 2012, I'm going to guess. It's been quite some time, and very much are encouraging our members to work and conduct their commerce in a safe and healthy way. So with that being said, thank you, gentlemen, once again, and I'll just advise those of our members who have been following our webinar series that our next one currently scheduled is May 13th, where we have Sean Moen of 9 Mile Brewing in Saskatoon, and he's presenting on the topic is Pandemic to Pandexit, Leadership and Crisis Management during COVID-19. So thank you all. We'll see you next time, and thanks again, Phil. Thank you, Ray. Appreciate your time, and take care out there.
Yeah, thanks. Thanks, everyone. Take care. Bye.
Bye-bye.
Bye.